One of the worst UK health failures in UK history. I think they're being a little generous in saying one of. I can't honestly think of another health failure, keyword there, failure, that has been more calamitous. But this is the finding in a report released today by the Parliamentary Science and Technology Committee, a board of 11 cross-party MPs chaired by a former Conservative minister, Greg Clark, and the Health and Social Care Committee, also 11 cross-party MPs chaired by another former Conservative minister, Jeremy Hunt. Two former Tory ministers heading a paper that damns their own party leadership for failure. The government will no doubt deny it, but when the country has been led by a man either hiding away, possibly occupying a fridge again, or swanning off on yet another foreign holiday when he's meant to be leading the country, as if MPs don't get enough holiday anyway, it's little wonder even members of their own party cannot deny the obvious. This Conservative government has led one of the worst responses to this global COVID catastrophe on the planet. The COVID-19 crisis has been one of the biggest global calamities to befall the human race in generations, and this report, called Coronavirus, The Lessons Learned to Date, also claims it to be the biggest peacetime disaster in a century, though peacetime is a relative term, depending on where you live. It's affected every corner of the globe, after all. Not everywhere is experiencing peace, but that's another rant for another time. Over 150,000 people in the UK have died. That's fully 3% of the 5 million people globally who have died from this virus. That's just us on our tiny little island without any land borders with any other country. How, when we, geographically speaking, can so easily isolate ourselves and protect our citizens, did it go so wrong? Well, let's start with the pandemic planning. The report is somewhat kind on this in that it claims our planning was based on a flu model, which has not worked when other pandemics countries have faced, the likes of Ebola or related coronaviruses to COVID-19, such as SARS or MERS, has been faced. Our planning was done in a hurry because, despite there apparently being a pandemic plan for the nation, it went missing when we needed it, or at least that's what we were told. This plan dates into 2005 and was based on an outbreak of the more fatal but related SARS virus. Both are types of coronavirus. The Independent uncovered it and broke the story in August, saying 20,000 lives could have been saved and lockdowns could have been avoided if we followed this plan. It would have required implementation earlier, however. If followed, the UK would have begun acting on it in January instead of late February of 2020. Started acting on it when things were exploding out of China, instead of twiddling its thumbs as if somehow bored, watching this disease roll across Asia and Europe, killing thousands as it went. And then Johnson deciding to go on this morning with Bill and Holly, saying we should just let people catch it whilst they nodded along and posed for selfies. No, Johnson and his cabal of indifferent imbeciles decided to follow the old UK flu response plan, when it finally dawned on these dimwits that letting it blow through us would kill a lot of people. Presumably because they believed, as has often been repeated by dishonest right-wing sources, or thought they could get away with it by implying it's only flu. Well, flu kills on average 13,000 people a year in this country, and that's with a tailor-made vaccine on offer each year. We now have a vaccine for COVID. Its rollout has been cack-handed as hell, but we didn't have it to start with, of course. And despite having one now, over 1,000 people a week are dying here still. That's 52,000 people a year. It's not flu. It's more than 3 times as lethal on current figures and rising again. And that's not to mention the long-term effects many have due to long COVID, still poorly understood. And nobody in this country's government is trying very hard to understand it. So we weren't very well prepared for this pandemic because we picked up the wrong report for the wrong sort of disease. That mattered. But no, it got worse. As I said before, we're an island. You'd think closing borders would be a no-brainer. Turns out the government literally had no brains, no common sense. They just kept the airports open, let people continue to travel freely. Massive global travel hub as we are here. And we just essentially kept rolling out the red carpet for COVID. It might be a coronavirus. It might resemble a crown superficially to look at, but royalty it ain't. It's a killer. And again, how many lives could have been saved if we locked our island down properly at the start? It was never a consideration until it was far too late. What to do with it once here? Our underfunded NHS was quickly becoming overwhelmed. The most vulnerable, the most sick were chiefly the elderly. So what to do? Send them back to their care homes. Send them back amongst other vulnerable people. Throwing a protective ring around them, they told us. This government turned them into leper colonies with obvious tragic consequences. And as if Matt the Muppet Hancock hadn't screwed up enough on that front as health secretary, procurement of PPE was another disaster. We simply weren't prepared because we prepared for the wrong thing. Mask shortages, nurses wearing bin bags. We all remember the situation. We also all remember the massive crony contracting to the likes of pest control companies that led to millions being spaffed up the wall on inadequate, substandard equipment that couldn't be used. Even as people were dying in the midst of a pandemic, clutching the pearls of capitalism continued, and it failed us as it always does. Johnson was reported to have said of Hancock, "He's a fucking idiot." Well, he's an idiot you wouldn't sack, and he didn't go until someone leaked footage of him having an affair. So what does that make you? Not once was he, nor has he since been brought to book for his failures. From the get-go, the government's go-to response was to manage the virus, let it spread in a way they thought they could control, and this report lays it out in stark terms that not once did they ever consider ever trying to stop it or wipe it out. It has always been about herd immunity. At that time, there was no vaccine, nor one on the horizon, yet this government was prepared to let it run through the population anyway. They placed a price on all of our lives and decided it was worth paying. They couldn't control it. People died in their thousands, and a lockdown for public safety was eventually implemented. But by then, it was about damage limitation, not protection. We're told that we'd have never accepted lockdowns, but we did. And the fact our government didn't have enough faith in us to do the right thing is as grotesque in light of the situation as it is insulting. Any who place their faith in this government still should know that that feeling is not reciprocated. Community testing would have helped us get on top of this situation, and we did start it, but got stopped after the issue of capacity was raised. We need a fully functional operational health service capable of dealing with a pandemic in the event they should happen. They have before, they will again, and this one isn't over yet. The Tories over the last 11 years have passed legislation to chip bits off of the NHS and sell them to profiteers, leaving a smaller, less well-funded health service behind. One with currently 98,000 vacancies we can't fill. If the health services couldn't cope, that's on the government too. Though Johnson is, of course, fortunate they were still able to save his own miserable life after he caught the virus himself. Still never caused a change of approach, though, has it? Lockdown eventually came, but it was too late, held back, as this report spells out, because the government was worried about harm to the economy. It is always the economy that gets put first. Even as recently as a few months back, Boris Johnson was still barking about the economy in response to people over 80 dying once more in significant numbers, saying they should be more worried about the economy than their own lives. Let the bodies pile up in their thousands, he cried. An utter psychopath. One currently living it up in Marbs instead of doing the job he was elected to again. Lazy oaf that he is. They needed some positive headlines, and the loyal, servile, right-wing press delivered with 100,000 tests a day set as an arbitrary target by that idiot Hancock. But this was a sticking plaster solution to a situation they'd let get out of hand and, of course, repeatedly missed targets to achieve. Also announced without either public nor governmental support, as it turns out, as this report has also spelled out. Test and trace should have been the core of dealing with the pandemic, isolating people and reducing the spread. But of course, they tendered it out to Serco, put Dido Harding in charge, a woman whose litany of career failures is an actual achievement to be as bad as it is. And of course, the government magic money tree got a good shaking to produce £37 billion for her to completely waste, quite honestly. It failed horribly. No money for the poorest, no money for investment, but always money for Tory cronies to waste. The thing of the good such a vast quantity of cash could have done, could do right now. It really ought to detonate any notion of fiscal responsibility in the Tories. New variants have sprung up in this country, each a testament to failure. Social care was left to flounder without support. The government claimed to have looked at how much more successful countries were reacting, such as South Korea, for example, but no evidence could be found that they ever did. Further lockdowns were required, each one of these as well, a demonstration of governmental failure to still get a handle on things. They know it too, which is why they're so reluctant to admit failure again and a call for another one. And of course, the media so rarely report on COVID stats anymore. We're left to look them up online if we think to do so. Despite being one of the first countries to develop a test for COVID, we blew taking advantage of that with ongoing incompetence. Schools have always been drivers of this virus and remain so, yet we're consistently amongst the last places to close and first to open. And if I'm going to criticise this report in any way, it's that the executive summary to it doesn't even mention schools. Furlough has been a complete ball ache for so many, and many businesses have gone under. For a government so obsessed with protecting the economy, they've created significant economic damage through their mishandling of the COVID crisis, and have not even brought Brexit into the equation, which has, of course, been even more economically damaging. They've removed mitigations such as mask wearing, bubbles, contact tracing, social distancing, and we're watching the virus surge again as we're going into another bleak winter period. This report is damning, though not as much as it could have been. It's certainly a significant condemnation of government failure, though. Sadly, that failure isn't over yet. It's still ongoing. As many as 1 in 14 children in school now have it. Vaccine rollout to 12 to 15-year-olds is far too slow. And the vaccine is not mitigation enough on its own anyway, as hospitalizations and deaths once again rise due to COVID. This COVID crisis has been grossly mishandled by Boris Johnson's government, and sadly, it still is.